Can you imagine growing replacement organs in laboratories to help suffering people who need organ transplants? Sounds like science fiction, doesn't it? It's not, and it's stem cell research. Stem cell research and embryonic stem cell research is still in very early stages, but has showed much promise in treating many medical conditions. Stem cells are being used to treat everything from blindness, blood disease, cancer, spinal cord conditions, to even ALS, which is Lou Gehrig's disease. This sounds very promising, doesn't it? It doesn't even scratch the surface of the possibilities of stem cells and stem cell research. Human embryonic stem cells, or HESCs, have been used in a handful of clinical trials so far to treat everything from spinal cord disease to blindness. These HESCs have been used to grow replacement cells that can be used for retinal cells in people that have macular degeneration and Stargardt's macular dystrophy. They basically grow these cells in the laboratory and then surgically implant them into the people, and it helps regenerate the retina and cures these people of blindness so far in clinical trials. HESCs are the ones that are used out of dead baby fetuses, and that's why they're controversial. So a lot of that testing's been halted, even though there's been lots of promise in that field alone. Human spinal cord stem cells are being used by NeuralStem, a biotech company out of Maryland, to treat ALS. 12 people have been put on clinical trials to treat ALS and are receiving a surgical implant of stem cells in their lower and cervical regions. This is shown to not cure it, but treat a lot of the symptoms from it and help reverse some of the effects of it to give these people more of a quality of life. This is pretty impressive research, if you ask me, because that's a pretty devastating disease that it just kind of, it doesn't affect a lot of people, but the people it affects, it dramatically affects them. The next form of stem cell research probably has the greatest implications at helping a large number of people, just because this disease affects the greatest amount of American citizens each year. The third is basically Oriasis Therapeutics is conducting a phase 2 clinical trial of 220 people that have all had heart attacks, and basically they inject stem cells into their heart, and it repairs the stem cells grow and repair heart tissue, and it's been pretty promising so far. They're trying to not stop people from having their initial heart attack, but 26% of people that have a heart attack within 6 years have a second heart attack. So Oriasis is basically trying to prevent that second heart attack from people that have damaged their heart muscle to begin with. It's proven very effective. There's 220 people in the trial right now, and it's a phase 2 trial, so it's already gone through phase 1, which is impressive. This is a very fascinating one to me because it can help a large amount of the American citizens. So many people, so many people suffer from heart disease each year. These are a couple forms of stem cell research. There are many more out there. You can get on clinical trials and look at all these different forms. These alone are fascinating, and these alone should make you want to learn more about stem cell and stem cell research. Stem cell research is being used in clinical trials all over the country and all over the world to treat patients with blindness, spinal cord injuries such as ALS, heart damage due to previous heart attacks, cancer, and many other conditions. Even with all the clinical trials going on now and the ones completed, we are still in very early stages of stem cell and embryonic stem cell research, and this is a whole world of possible medicinal benefits we have yet to explore, and we are not using so. As you can see with current advancements in stem cell research, growing entire organs are plenty possible in the future, and this is something that may be occurring sooner rather than later. one day in the very near future, maybe as soon as 10 to 15 years from now, they may be growing whole organs in laboratories and planting them in the people, and the organs keep growing in the person, and the risk of the heart or whatever organ rejecting from the person's body is a lot less because it's made out of that person's stem cells. So their body accepts it more easily, and they don't have to take the pain or the rejection medicines as much, and it's just a better process than implanting a whole heart from another person that's not their actual tissue. So these are some of the benefits to stem cell research. So I hope you explore it.